I would now like to demonstrate a cement or liberatory maneuver that can be utilized to treat either anterior or posterior BPPV. So the first position in this maneuver is very similar to the sideline position, and what we're going to do is assume that Matt has right-sided posterior canalolithiasis. All right? So first maneuver is going to be to position his head 45 degrees to the left here, and now we're going to go ahead and hold his head position while we ask the patient to drape their arms over ours. All right, now we're going to do basically a sideline test to the right. Here assessing for the right posterior canal. We wait for the symptoms to subside. And next we're going to instruct our patient to, on the count of 3, swing their legs off of the table while maintaining this head position. You as the clinician will help aid in the maintenance of this head position. All right, so the nose is going from an upward position to where it's going to be facing the plinth in the next position. So on the count of 3, swing your legs off, and we're going to be going onto your other shoulder, all right? You ready? We're going to do this quick, okay? 1, 2, and 3. All right. Here what we want to do is we want to reassess for symptoms. A good sign is if the patient is becoming symptomatic. That indicates that the debris is migrating through the posterior canal. If we want to, we can help that migration by asking the patient to go ahead and tuck their chin in a little bit. We can perform some more rotation as well. And we want to wait for the symptoms to subside. That indicates that the debris is now back into the utricle. And once that has occurred, and this patient no longer complains of symptoms, we're just going to ask them to go ahead and sit back up. All right? And here, again, reassessing for symptoms. If the patient is not dizzy coming back up into this position, that is a very good sign that we just performed an effective treatment for posterior canalolithiasis.